So, for instance, now if we look at pulse, in Herring's Guiding Symptoms, which is 10-volume book or work, there may be thousands of remedies, hundreds of remedies and thousands of symptoms that have pulse as their heading. Out of them, those symptoms that were consistently produced by a medicine, such symptoms that were proven in the first drug provings and then repeated in almost every drug proving and were clinically useful, leading the physician to those particular medicines and curing those patients. Such symptoms were highlighted, and those highlighted symptoms are taken. So under one medicine, suppose there are 15 such highlighted symptoms. Those 15 highlighted symptoms are taken and compiled as one book called the Ellen's Keynote. These are the characteristics of that particular medicine. So not every medicine will have a symptom that is related to pulse, which is characterizing that remedy, or which is a characteristic of that remedy. You get it? So there are thousands of symptoms that talk about pulse, but not every medicine has a characteristic symptom that talks about pulse. Not every medicine has a characteristic pulse. Now, those medicines that have pulse in their characteristic symptoms, their list, as Manna has compiled, and he says that in the Ellen's Keynote, only these 10 or 11 remedies or medicines have a characteristic symptom related to pulse. Which are these medicines? Amylinum nitrosum, digitalis purpurea, diphtherinum, gelsemium, glonoin, calmia latifolia, naja, pyrogen, Secalcor, tabacum, veratrum viride. So these are the medicines which have many characteristic symptoms, but among them, one of their characteristic symptom is related to pulse. Now I will read the symptom. Amylinum nitrosum rapidly dilates the arteries and accelerates, but later weakens and retards the pulse. So this is a compound that dilates the arteries and accelerates the pulse first, but later weakens and retards the pulse. I don't know how this particular symptom would be useful to us in conjunction with other symptoms of a particular case. But the point here is amylinum nitrosum is a medicine that has many characteristic symptoms. Among them, one characteristic symptom is related to pulse. Digitalis purpurea, pulse full, irregular, very slow and weak, intermitting every third, fifth or seventh beat. So this is very well explained symptom. We may find this symptom. I have found this symptom several times. Pulse very slow, very weak. You would try to hold the patient and hold his hand, and you feel the pulse. Pulse is very weak. Pulse is very slow, sometimes below 40, and sometimes it is intermitting, third, fifth or seventh beat. So it is kind of, the patient would have some heart condition. Many of the patients who got digitalis have heart condition, and their pulse is slow, pulse is weak, pulse is almost below 40 and intermitting every third, fifth or seventh beat. You won't find in every case the intermitting pulse, and in every case, if of intermitting pulse, It may not be intermitting at third, fifth, or seventh beat. It may be different for each case. But if the patient is digitalis or he needs digitalis, then you may have either slow and weak pulse, that may be the only symptom that you get, or you may have pulse that intermits every third beat, or you may have pulse that intermits every fifth or seventh beat. You get it? So this particular symptom is a characteristic symptom of digitalis, and a part of this characteristic symptom also can be used to prescribe digitalis in a given case if the rest of the symptoms agree and fall and point towards digitalis. Diphterinum, pulse weak, rapid, and vital reaction very low. That's all. Rapid pulse but weak pulse. Diphterinum. Gelsemium, slow pulse of old age. So when you get old age people, think of gelsemium if they have a slow pulse. Glonoin, terrific shock in the head, synchronous with the pulse. So every time there is a pulse beat, there is terrific pain in the head, terrific shock in the head. Calmia latifolia, pulse slow, scarcely perceptible, 35 or 40 per minute. Pace fail and cold extremities. Pace is pale and extremities are cold. We know why it happens, because blood flow is slow and low. Pulse is slow and it is scarcely perceptible. It's weak pulse, 35 or 40 per minute. Calmia is very similar to digitalis in this matter, so we have to differentiate between these medicines. Naja tripudens, pulse irregular but regular in rhythm, irregular in force but regular in rhythm. Pyrogen, pulse abnormally rapid, out of all proportion to temperature. So it's a fever case and there is the pulse is small, wiry, 140, 170, and it's out of all proportion to the temperature. Temperature may not be so high, but the pulse is very rapid. That is pyrogen. Cecale core, pulse small, rapid, contracted, and often intermittent. Tabacum, pulse quick, full, large, small, intermittent. So it can be given for people who have a quick and full pulse. It can be given for people who have small and intermittent pulse. So this is how you have to read this characteristic symptom. You cannot just say like, okay, in every case you'll find everything. You won't find everything in every case. That's not the point. The point is, tabacum is a medicine that has a characteristic symptom that would lead you to tabacum under the title, under the topic pulse, under pulse. And in tabacum cases, sometimes you may find quick and full pulse, sometimes you may find small and intermittent pulse, and it may add to the rest of your data that is pointing towards tabacum if the patient needs that medicine. Pulse exceedingly slow. So pulse can be rapid, full, or it can be exceedingly slow. But if the patient has something related to pulse which is very characteristic of the patient, then you have to think of a medicine that has a characteristic symptom related to pulse. If that is how your analysis ends, and you see that these are the significant symptoms that you have to seek similarity for, among them there is a symptom related to pulse, and at that point you have to think of these 11 remedies in particular which have a characteristic symptom related to pulse, and specifically you have to think of the medicine that has that particular character of pulse. Pulse feeble, irregular, almost imperceptible. Veratrum viridae. Pulse suddenly increases and gradually decreases below normal. Slow, soft, weak, irregular, intermittent. Now in the brackets, digitalis and tabacum are given. So if there is irregular pulse, intermittent pulse, and it is very characteristic of the patient, you feel that this should be there among the main symptoms which you are going to use to prescribe, then you must think of at least 3 remedies: Veratrum viridae, digitalis, and tabacum. Irregular, intermittent pulse is found in these 3 remedies in the keynotes or in the most characteristic symptoms. If you go to the repertory, what would happen is you will find intermittent pulse. Under intermittent pulse, you'll find like many medicines. Under this thing, irregular pulse, you would find many remedies, many medicines. But these medicines may suit the patient and may help the patient, but may not cure the patient, because the remedies may not have produced this as a characteristic symptom. As I defined before, a characteristic symptom is a symptom that is produced every time you give that medicine, almost every time. And not only is it repeated in the drug provings, it is also proven clinically. And that is why Herring has put it in bold, has given it the most number of points. So it is a symptom that has the most number of points in Herring's guiding symptom, and that symptom has been taken from there and placed in the Ellen's keynote so that we can refer whenever we need. And that symptom, along with the symptoms of other medicines which have a symptom related to pulse, has been grouped together by Mr. Manna, Mr. P.K. Manna, and what he is doing is he's grouping together all those medicines that have pulse in their characteristic symptom, or that have cough in their characteristic symptom, or that have constipation in their characteristic symptom, and then he is writing those characteristic symptoms against those remedies. It makes analysis much more easier, and this analysis will take place after you have taken the case thoroughly, you have found those symptoms on which you are going to base your prescription, like the most characteristic symptoms of the patient, and then you are going to use these characteristic symptoms. You are first going to repertorize them, and after that you would come up with like 10 or 15 medicines. Then you would look at the most characteristic symptoms which you want to include in the totality of symptoms, and those symptoms you would look for the medicines that have a similar characteristic. The medicine has produced a symptom in an emphatic way. Such medicines you will compare this with and try to find the most indicated remedy. So this comes at the final step of the analysis, where you are using the Materia Medica to decide between those 5 or 10 medicines that repertory has brought you to. That is why the study of Materia Medica is very significant. If you do not know the Materia Medica, if you do not know the Ellen's keynote, if you do not know which all are the characteristic symptoms, you will never become a good prescriber. God bless you. Have a great day.